We see a lot of people that have had pain on and off for years, and often they'll have a bout of pain for a few days and then it gets better, and then 6 months later they'll have another bout of pain, and for a long time they've been able to deal with it by themselves and get along pretty well. And then after sometimes years of this happening, they'll have an episode where their pain flares up, and then all the normal things that they've done over the years, the ibuprofen and the hot packs or the heating pads, aren't really helping anymore. And so that's when we often get to see them, and they're coming to therapy looking for more help. I think that they're very surprised at what it is that we evaluate. I think we have an advantage over the physicians even in being able to evaluate a mechanical problem that's going on in somebody's spine or in their hip that is causing an overuse injury or causing a muscle guarding that isn't able to just go away on its own once their initial acute injury has healed. They come back and visit, and they say, hey, look at me, I was just down seeing the doctor for this, and I wanted you to know I went on my vacation, I was able to go hiking, and I didn't have any pain. So that is a good part of it. I mean, there's a lot of different structures in your spine that can create pain. You've got joints, you've got ligaments, you've got muscles, you've got nerves and discs, and all of those different structures can create pain symptoms. And so you have to be able to figure out what it is that is causing that person's particular pain in order to design the right kind of treatment program to help them learn to manage it on their own. Posture, I think. You know, there's a lot of different kinds of postural problems that people can have depending on what their work situation is, what muscles they use day in and day out. When you do an activity over and over and your muscles are strong, they become shortened and tight, and that affects how that joint can move and which other muscles are being overused or overstretched. So it really does make a difference. I think people sometimes will see a photograph of themselves, and especially when they start to get more and more rounded and like, oh my God, I look like my aunt in this picture and I don't want to look this way, and they didn't even know it was happening to them until they see it from that outside. We see a huge variety from neurological disorders such as MS and Parkinson's to pediatric patients, people that have been involved in car accidents or just been sick or had a surgery and are deconditioned and have pain. I see probably 90% back and neck pain patients because that's my favorite. That's what I've done a lot of extra training in, and that's my expertise, but I do treat people with other disorders as well. I think having that one-on-one caregiver to help you through this whole process is very important, and that's one thing that's special about being able to work here at the Med Center is that I have all my own patients, and when I evaluate them, they are my responsibility, and I am in charge of making sure that they progress and they meet their goals, and we change their treatment program if we're not getting where we want to be. And so a lot of other facilities, you'll go in, you might be evaluated by one person, next time you see somebody else, and in the course of your treatment you might get 3 or 4 different people who aren't all aware of what the other one has done before them and what's worked last time or what you might have already tried that didn't work. And so by being able to personally be in charge of their whole program, then that gives me much better success rate in helping people to get better.